Welcome back everyone. In this video I'll be teaching about the plasma protein binding. This is an important question for university exam, and clinical importance is also important. Sub question under this topic. Plasma proteins, you know, albumin and alpha acid glycoprotein. These two are examples for plasma protein. Plasma protein binding, as the name says, the drug goes and binds to the plasma protein. This is a plasma protein binding. What are the clinical importance of this plasma protein binding is, whenever we take the drug that enters into the local GIT and then goes into the intestine, and then there will be absorption in the small intestine, and then it enters into the circulation. In circulation, that means it enters into the blood. In blood, you know, plasma proteins will be there. These plasma proteins, example, albumin and alpha acid glycoprotein. Albumin, for albumin, all the acidic drugs will bind. So AA you can remember, acidic drugs will go and bind to albumin, and basic drugs will go and bind to alpha 1 acid glycoprotein. This binding will decreases the availability of this drug into tissues, like site of action. So it decreases the pharmacological action. So it is temporarily stored. Whenever it is required, that will be released from the plasma proteins, and then that shows pharmacological actions. So bound form, it is reversible, so that can become free form. When in free form it shows pharmacological action, whereas in bound form it cannot show any pharmacological action, so it is temporarily stored form. What you learned, like examples, like I learned plasma protein examples and how it is how it acts, the plasma protein bind, how it works. You have learned the mechanism. And the importance of this is, if the drug is highly plasma bound, then it will be low volume of distribution. As you know, like it is bound, it cannot be gone and given to the tissues for metabolism. If it is a plasma protein binding, there will be delay in metabolism. Whenever it enters into the tissue, like liver, intestine, GIT, whenever it enters into that place, only then metabolism takes place. So the metabolism is also delayed. And excretion, it cannot be filtered through glomerular filtration, so excretion is also delayed. Filtration is delayed, so excretion is delayed. And it has longer duration of action. As it is binded form, whenever it is required, it can be released, and then it shows the longer duration of action. Example will be sulfadiazine. When plasma protein bounded, without plasma protein bounded, less plasma protein bounded, it has only 6 hours of action. Whereas sulfadiazine with high plasma protein bound, it shows 1 week action. So there is a prolonged duration of action of these drugs will be prolonged. And in case of poisoning, if it is plasma protein bounded, in case of poisoning, it is difficult to remove. Like it is already in bound form. If it is in a free form, you can easily excrete it by giving like excretion form of drugs. So the drugs which increase the excretion of the drugs we can decrease the toxicity. Whereas in case of highly plasma protein bounded, it is a bound form, it is very difficult to remove. And the proteins, whenever there is a chronic liver disease, liver only produces this albumin and all, like plasma proteins are synthesis in the liver. In case of liver diseases, there will be low albumin, so hypoalbumin will be there, so low binding. This leads to drug toxicity. All will be available in the free form only. All will go and have the pharmacological action and go to their site, and then they will act. So this, in chronic liver diseases, there will be drug toxicity. And in renal failure, all albumin is excreted through the kidney, and then excreted. So in renal failure or nephrotic syndrome and all, there will be more excretion of albumin, so less albumin available for the binding of this drug. So there will be drug toxicity. And in case of anemia, is also there will be drug toxicity because it causes hypoalbuminuria. And the other thing will be the displacement of the drug. When the same plasma protein is required for the binding of one or more drugs, the high affinity drug will displace the low affinity drug. So high affinity drug, when one or more drug act on the same plasma protein, high affinity will displace the low affinity. So the one which is binded now, that is a high affinity drug, will be having less action, pharmacological action, whereas low affinity drug is not bounded, so it is a free form. The toxicity of the low affinity drug will increases. The concentration and free of the low affinity drug will increases. This is all about the plasma protein. How the mechanism how the plasma protein bound form and free form you have seen, and in case of all the plasma